What's your name?
Aman.
Are you comfortable?
Yes.
Have you had any coffee or tea prior to 30 minutes?
No.
Or any physical activity?
No.
Okay, please. Your right arm. It's not that tight, right? Your BP is normal, that is 90 and 120.
I am Cerebellum. Can I know your name and age, please?
Yeah, myself Sarfaraz Khan and my age is 23.
Okay. Today I am going to examine your eye. Is that okay for you?
Yeah, okay.
Okay. I will check your visual acuity. Close your eye with this card and read the smallest line possible.
D, E, F, T, O, T, E, C.
Okay, that's good. And I will check your near vision. Read any line from this book.
So many critical structures like the sensory organs, cranial nerves, and the major blood vessels originate in the head and the neck. Okay.
Okay, now we are moving to the next step.
Yeah.
Look straight into my eyes. Close your right eye with your right hand. And say where you can see my fingers clearly. Okay?
Yes. Now I can see.
Okay. This one.
Yes. Yes.
Okay, that's good. Okay, sir, follow look straight. Everything is good with your eyebrows. And there was a good hair distribution. And close your eyes. There was no swelling and no lesions on eyelids. Open your eyes. Okay, I can see a normal palpebral fissure in this patient. And the eyeballs are in the bony socket. Okay, now sir, just follow this pen, but don't move your head. Okay, close your eyes again. Okay, there is a normal direction of growth in eyelashes. Okay, that's fine. Now I inspect your conjunctiva and sclera. Look right, left, look up, look down. Okay. Now I use oblique lighting to test your cornea, lens, and the iris. I cannot see any aberrations or opacities in the cornea and lens, and there were no shadows in the iris. Okay. Examine your pupils. I am going to switch off the light. I can see a normal size in the pupils, and also I can see a consensual reaction. Now I will see how your pupils accommodate. Look at this pencil and look on the wall. Look at the pencil and look on the wall. Okay, for your eye movements, you just follow this finger. Okay. I am going to use this instrument to see inside your eyes. The wall there. Okay. Okay, Sarfaraz Khan, everything is fine with your eyes. No need to worry. Thank you for your cooperation.
Thank you.
Hand washing. My name is Jagriti Bhardwaj. I'm a second year med student. What's your name?
Ayushi,
How old are you?
18.
Okay, so do I have your consent for ear exam for today?
Yes.
Thank you. These are the requirements for our ear exam: the otoscope, the tuning fork, a sanitizer, and a pen and paper to write the recordings. The first test, we begin with inspecting the auricle and the external ear. So after inspecting, there are no signs of inflammation, no bulging. Behind the mastoid looks clear and normal in size, and the tragus looks normal as well. For the next test, we have to use the otoscope to examine the inside of the ear. If it's anytime uncomfortable, do let me know. So this is the proper way to insert the otoscope and switch the light on. I hope it's not uncomfortable. Alright, so proper pars tensa, pars flaccida. I can see a normal cone of light. No further abnormalities reported. We'll repeat the same with the other ear. So next we'll be doing the whisper test. I'll be whispering a few words and letter combinations while I'll obstruct one of your ear. Do repeat whatever you hear, alright?
5xy. 2ab.
Okay. We'll do the same with the other ear. So for the hearing test, we are first going to do the Weber test. I will be placing the tuning fork after striking it on the middle of your forehead. Let me know if you hear it equally in both ears or it's lateral in one ear more. Is it equal in both ears?
Yes.
Next we do Rene test. For that we'll have to place it on the mastoid first and see the bone conduction. Tell me when you stop hearing it.
Now. Now.
Okay, thank you.
Hello, my name is Dr. Apurva. Could I have your name and age, please? I'm Oropharynx and I'm 23. So what I'd like to do today is I'd like to examine your nose and nasal passage as well as the mouth. Examining your nose and nasal passage involved me having a look at your nose and taking a speculum and putting it into your nose and having a look around as well as feeling your face. I would also like to use a pen light to check if there's any abnormalities with your sinuses. Would that be okay? Yes. If you just make sure that you're looking forward for me, we're going to start by inspecting the nose for symmetry or deformity, or if that looks okay. So we're going to go and press down on your nose. Just tell me if there's an issue or is it hurting. So, no issues. Okay, so that's good. So to check if there's an obstruction, I'd like you to press on the one side of your nose and breathe with the other. So like so. And now can you repeat with the other? Okay. Now I'm going to take the speculum and put this into your nose. So if there's a problem or discomfort, please let me know. Sure. Can you please tilt your head backwards for me?
The septum looks fine.
Okay. Check the other side. Okay, so there's no redness, no crusting, the terminus was good, and there's no sign of any polyps or any abnormalities, so that's good. Okay, so to examine your sinuses, I'm going to start off by placing my thumbs under your eyebrows, and then I'm going to go in and up. So does it cause any discomfort? No. Okay, so for your maxillary sinus, I'm just going to look at your cheekbone, and then I'm going to go in and upwards. Does that cause any discomfort? No. Okay. So for the next part of the examination, I'm going to have to switch off the lights, and we're going to eliminate your sinuses to check if there is a fluid buildup or any other abnormalities. Will that be okay? Yes. Now I'm just going to place the light just below the brow and cup the hand over the light, looking for a warm red glow in the frontal area. Now I'll have to ask you to tilt your head backwards and open your mouth. Now I have to place the light against the cheekbone and just below the eye, and the presence of reddish glow indicates the normal air-filled sinus. Now let's move on to the examination of the oral cavity. This involves me looking at your lips inside your mouth and also using a tongue depressor to put it into your mouth to depress the tongue and having a look around as well as touching your tongue, teeth, and gum. Is that okay? Yes. Okay. We're going to start examining the lips, if they're symmetric or pink, smooth and moist, no lesions or deformities. Now I'm going to use a tongue depressor. Let me know if you have any discomfort. Now, if I may ask you to open your mouth for me, please. So there's no ulcers, nodules, or patches. So, okay, that's good. Moving on to the teeth. Checking for teeth for caries, discoloration, filling, missing or broken tooth, or misalignment. Now I'm going to check the gums, if they're tight and pink. Okay, then checking the roof of the mouth for any discoloration. And then, now if you could please protrude your tongue for me. It's of normal size, normal color, there's no lesion, it's moist. Okay. Can you open your mouth again for me, please? Say ah. Once more ah. Okay, so everything looks normal. There is no redness of the uvula or the soft palate, or any sort of swelling or ulcerations. Now we're palpating the sides to check for any abnormalities. There is no swelling or anything, and everything looks normal. So that is the end of the examination. Thank you.
Make sure to sanitize first. Hi, my name is Harita. I am one of the medical student. May I know your name and age?
I am Triveni. I am 35 years old.
Okay, that's good. Now I am going to examine the oropharynx and neck. Is that okay with you?
Yeah, okay.
Okay, thank you. Open your mouth. Say ah. Now inspect the soft palate, anterior and posterior ridges. Anything changes on the color and the pattern and symmetry. If there are any exudates and ulcerations, nothing should be there. That's normal. Now I am going to do the gag reflex. That's a bit uncomfortable. Is that okay with you? Thank you. Say now. It's the gag reflex, just touching the roof of the mouth. Okay, it's okay. It's not, everything was normal. Position of the neck. Inspect for the symmetry, mouses, cords, and look for the enlargement of the parotid and submandibular glands. And to palpate the lymph nodes, make sure to use the pads of the index and middle fingers. Just move the skin underlying the tissues in all over the areas. Now we are just noting the palpating of the preauricular nodes, postauricular nodes, occipital nodes, tonsillar, submandibular and sublingual glands. Now we are going to checking the superficial cervical nodes, posterior cervical lymph nodes. Check the trachea for a deviation. Place your finger along one side of the trachea. And note the space between it and sternocleidomastoid muscles. When compared to the other side, the space should be symmetric. Next, examination of the thyroid gland. Inspect the patient's neck. A tip of the patient head a bit back. Now observe the region below the cricoid cartilage for a thyroid gland. Ask the patient to take a sip of water. By swallowing, we can observe the upward movement of the thyroid gland. By swallowing, we can see a upward movement of the thyroid gland, cartilage and cricoid cartilage also. Confirming visual observation, first we can palpate the thyroid gland. For that, we need to palpate the isthmus, thyroid isthmus. It usually locates at the 2 to 3/4 the tracheal rings. To palpate the right and left thyroid lobes. Then we can observe any tenderness, nodules and goiter in these places.
My name is Dr. Mohammed Adnan. May I know your name and age?
Hello doctor, my name is Koki and I'm 20 years old.
I am a medical resident. I am going to perform lung examination. For that, I need to remove your t-shirt. Is that comfortable with you?
Okay doctor.
Before examination, I make sure my hand is clean. I will start my inspection on the posterior side of the chest area for any skin deformities or chest deformities or any lung obstruction. Can you please take a deep breath? On the palpation, I will be palpating to make sure there is no pain and tenderness. Do you feel any pain?
No doctor.
Chest examination, I am going to place my both hands in the space of intercostal space. Tactile formities, I am going to place my ulnar side of palm in the interscapular space. Can you please take a deep breath? Release. Again. Release. Again. Release. Palpation technique, I am going to use a percussor of finger and place it in the posterior chest. I am going to percuss in the rounded bottom. I am going to check the diaphragmatic excursion. There is no diaphragmatic excursion. I am going to use the diaphragm as a stethoscope and place it in the back chest behind. So, bronchobascular, which can be here first and second intercostal space. Can you please take a deep breath? Release. Next one is bronchial, which can be here in bronchus. Can you please take a deep breath? Release. And the last one is tracheal. Take a deep breath. Release. For added advantages, I am going to hear the sounds like wheezes, crackles and bronchi. Can you please take a deep breath? Release. Again. Release. So have abdominal sound. I am going to do the whisper peculiar loci. Can you please whisper 99? For bronchophony, can you please tell 99 loudly?
99, 99, 99.
For egophony, can you please say E?
E, E, E.
Myself Akshay, I am second year medical student.
Okay.
May I know your name and age?
Okay. My name is Piyush and I am 23 years old.
Okay. So today I would like to examine your cardiovascular system. So may I have your consent for it?
Okay, yes.
Okay. So let's begin.
Yes.
Always begin the cardiovascular examination from the right side of the patient. Firstly, I will inspect and palpate the vessels of the neck. For this, I will ask patient to lie supine and elevate the thumb from 30 degree horizontal. Turn your head to right side. Now by shining the light obliquely, I will note the highest point of the venous pulsation. Now I will measure the jugular venous pressure. For this, I will find firstly the sternal angle. At sternal angle, I will place the first ruler in the vertical direction. And I will place the second ruler horizontal at the right angle to the first scale, such that the lower edge of the second ruler lies at the top level of the venous pulse.
Start.
Now note the level of the ruler 1 and add 5 cm to it, since the sternal angle is 5 cm away from the right atrium. Now I will palpate the carotid arteries. For this, I will palpate at the medial end of the sternocleidomastoid above its base. Make sure that you should palpate the carotid artery one at a time. I will inspect and palpate the precordium. For that, I will note first the location of the apical beat and note its amplitude, rate and rhythm. Now I'll palpate the hips, lifts and thrills. For this, I'll place my hand against the chest wall at the right second intercostal space, left second intercostal space, along the sternal area and at apex. I'll palpate the thrills. For palpating the thrills, I'll place the ball of my hand over the chest to check for buzzing and vibratory sensation caused by underlying turbulent flow. I'll palpate the S1 and S2. For palpating S1 and S2, I'll place my right hand over the apex beat and left hand over the carotid artery. Since the carotid upstroke follows the S1 and S2 lies just after the carotid upstroke. Now we'll auscultate the precordium. Firstly, we'll note the heart rate and its rhythm. After noting the irregularities and regularities of the heart rate, we will auscultate the 4 primary points over the anterior chest wall. Now we will identify the S1 and S2. So to identify S1 and S2, I will place the diaphragm over the base or apex and place my left hand over the carotid artery. Since the carotid upstroke corresponds to S1 and the other sound we listen is S2. Now I will listen to the splitting of S2. For this, I will ask patient to take long deep breath and listen S2 at the end of inspiration. Take long deep. Now we will listen for S3 and S4. For this, I will position the patient in the left lateral decubitus position and listen over the apex. Will you please turn left? Usually we listen the S3 in early or mid systole and S4 just before the S1. Now we will listen for systolic and diastolic murmurs. Okay, so this completes our cardiovascular examination. Thank you.
Hello, my name is Abdominal and I've been asked to examine your abdomen. First, I'll be inspecting over your abdomen. Then I'll listen over your abdomen with my stethoscope, and lastly I'll be palpating over your abdomen. Is that alright? Yeah. Okay, before I start with the examination, I just want to know whether you have some tender points or pain over your abdomen. No. Okay, let's start. Okay, I'll be inspecting over your abdomen first. Okay, that's alright. Now I'll auscultate over your abdomen. I'll listen for bowel sounds first, then I'll be listening over the arteries. Okay. Okay, that's alright. Now I'll percuss over your abdomen. I'll be tapping over your abdomen. Okay. Can you move to your left? Okay, you can go back to the normal position. Now I'll be palpating over your abdomen. Before I do that, I just want you to breathe from your mouth for a while. Okay. Now I'll be palpating a bit deeper, okay? Okay. You can start. Okay, that's it. Thank you.
Thank you.
Good morning, sir. My name is Cleta Sadanza Vijayan, and I am a second year medical student. Today I will be examining your liver and spleen. Is that okay with you?
Yes.
Can I verify your name and age, please?
Victors.
Age?
62.
Okay. First, we should find the span of the liver by percussion. So for that, first we should make sure that the legs of the patient are flexed and the chest part and the abdominal part is exposed. So for the percussion, we should start from right lower quadrant below the umbilicus and move upwards till we hear the dullness. It should be marked here. And we should, from the above, we should start from the nipple line, that is from lung resonance to liver dullness. Next, we should measure this. In case of my patient, the span of his liver is 8.5 centimeter. Next, for palpating the liver, we should place our left hand below the lower thorax and our right fingertips just below the liver dullness. So please take deep breaths for me. Now look for tenderness, consistency, surface and the edge. Thank you. Hooking technique is also useful in palpating the liver, especially in the patients who are obese. So for these, we should take both our hands and put our fingertips just below the liver dullness and press in and upwards towards the costal margin. So please take deep breaths. We should check for any tenderness at all. Next, for the patients with non-palpable livers, we should keep our left hand over the lower rib cage and strike with our right hand. Sir, did you feel any pain or feel any difference?
No.
Okay. In case of my patient, his liver is smooth, the edge is very sharp and no tenderness was seen and also no enlargement was seen. In case of spleen, we can't palpate spleen in most of the patients. So here, if we want to palpate, we should put our left hand below the thorax, below the posterior thorax and press with our right hand below the costal margin. So take a deep breath. Could you please turn to your right side? Make sure the legs are flexed. And in the anterior axillary line, from the 6th rib, we should percuss downwards and we should check for tympanic nodes. So take a deep breath. Here in this case, the tympanic node remains the same, and if it changes to dullness, it indicates splenomegaly. So thank you for the cooperation.
Hi there, my name is Mahima S. Kumar and I'm a second year medical student. Could you just confirm your name and age please, sir?
My name is Santosh Kumar. I am 50 years old.
Okay. Nice to meet you, Santosh. And today I've been asked to examine your shoulder, and this will just involve looking at the shoulders and then just assessing the movements of both the shoulders as well. Will that be okay with you?
Yes.
Okay. So do you have any pain at all before we begin?
No.
Okay. If you could just take off your shirt for the examination, will that be okay with you? And we'll just get started.
Okay.
Thank you. Okay, Santosh. So now we'll be doing some further movements. Just put your hands straight and just copy what I am doing. Okay? Just put it upward. Stretch it as much as you can. Now relax and get it down. Now stretch out your arms to the back as much as you can. And now relax. Okay, Santosh. So now bring your arms out to the sides and all the way to the top. And now take your arms back down and bring them across your body like this. Okay, now you can relax. Okay, so now I'm going to place my hands on your back, and if you could just bring your left arm out to the side and all the way up to the ceiling. Okay, you can relax now. Okay, now stay relaxed. Now ask the patient to flex both their elbows to a 90 degree and then place the arm on the dorsum of the patient's hand, externally rotating it, both the shoulders against the... For this test, bring the patient's affected arm to a 90 degree and then abduction and external rotation passively, and ask your patient to hold this in the same position and then relax your supporting hand. Now bring the hands together at the back while one hand from above and one hand from below, and repeat the movement. In the other, now for this test, passively abduct the patient's shoulder to a 90 degree and then his elbow is in flexion passively to abduct the patient's shoulder through a full range motion. Okay, so now with one hand I'll be depressing the scapula and with the other I'll internally rotate the arm and make maximum forward. Now elevate the patient's arm to a 90 degree or forward flexion and have it rest on one of my arm, and then perform internal rotation. Arms to the outside like this and bring it forward slightly and thumb to the ground. Okay, and let me push your arms.
Anatomy review of the wrist and hand. Major bones are phalanges, metacarpals, carpals, radius and ulna. Major joints of the wrist include intercarpal, radiocarpal and radioulnar joints. The carpal tunnel containing median nerve held in place by the transverse flexor retinaculum.
Ensuring hand sanitization. Hello, I'm Isis Soni, a medical school student of UPHSD. Your name? Aditi. Okay, nice to meet you. We'll be doing musculoskeletal examination of the wrist today. For that, I need to inspect your hands first. No signs of swelling or any trauma seen. Okay, now the thenar and hypothenar eminences. No signs of atrophy. We'll be doing inspection of only one hand for now. Now we'll be doing palpation of joints, radioulnar joints, everything seems normal. Carpal joints, now the anatomic snuff box, metacarpophalangeal joints, proximal interphalangeal joints, distal interphalangeal joints. Tell me if you feel any pain or tenderness over anywhere. Okay, no pain, no tenderness. Okay. Now can you put your hands like this for me? Okay, now hands back. Okay, now point to the ground, up to the ceiling, again normal, towards the midline, away from the midline. Okay, all the angles seem normal. Now we'll be doing hand grip strength test. For that you need to hold my two fingers and tightly. Okay, resist my force. Okay, everything seems good. Fine. Now for the finger steam test, grasp your thumb in your fist. Okay, now point it downwards. Do you feel any pain over here? No. Okay, for the carpal tunnel test, place your thumb upwards like this and resist my force. Okay. Now for the tunnel sign, I'll be tapping over here. Tell me if you feel any sort of tingling sensations. No. Okay. Now for the phalanx sign, can you place your hands like this? We'll wait for 60 seconds. Everything seems normal, no abnormalities. Okay, thank you. Now for the different motions, make a hand grip with thumb on your knuckles. Okay, now open it. Fingers extended. Okay, now fingers close together, away from each other. Everything seems good. For the thumb range of motion, point your thumb towards the base of little finger. Okay, and away from it, extend your thumb. Okay. Now can you put your palms up like this? Okay, now can you point your thumb towards me? Okay, now away from me again, normal. Now touch your fingertips with your thumb. Okay, everything seems good, everything seems normal. With that, we are done with the musculoskeletal examination of the wrist. Thank you.
Hello, my name is Harsh Sharma. I am second year medical student. I am going to check your knees today. It is simple test. It is without any discomfort and pain. If you feel any discomfort and pain, please let me know. Do I have your consent to test your knees? Thank you. What is your name?
Siddhant Sharma, 23 years old.
Okay, please lay down. Okay, first I will inspect your knee for any deformities, any atrophy, any edema, any erythema, any warmth. Okay, please extend your flex your knees. Okay, now I will check the normal hollow space of patella. Okay, please extend your knees. Okay, now I will palpate your knees, and first I will do a supra patella pouch for the edema, to check the edema. Okay, thank you. Okay, thank you. Please flex your knees. Okay, now I will check your tibia, femoral joint. First I will go for the plateau of it. Okay, now I will check the medial meniscus. I will look for any tenderness. If there is any tenderness, that means there is some partial tear. Now I will check for the lateral meniscus. Okay, now I will go and check for the medial condyle. Now I will check your medial collateral ligament and see if it is normal. Same with the lateral side. I will check the lateral condyle. Now lateral collateral ligament. Okay, sir, please flex your knees. Okay, now I will check the range of motion. Please stand on the edge of the bed. Okay, now extend your knees. Alright, stand up. Extend your knees. Alright, okay. Now you have to internal rotate this one. Try to rotate this knee inward. Alright, external. Alright, this one please. Alright, external. Okay, thank you so much. Cut. Some test known as McFadden test. It is for your ligament. First I will flex your knees. Okay, then I will extend your knees with the internal rotation. Alright, I will do this 2 or 4 times to see what is the lateral collateral ligament will do. Same with your middle collateral ligament. I will do the same test with the outward leg. Okay, please lay down. Okay, now I will check other test which is known as valgus straight test. It is you will push your knees inward and the ankle side with the lateral, and you will try to open your knees and see it if there is any tear. Alright, same with the lateral side. We will do that. Okay, please lay down. Now I will do another test known as Lachman test. It is also for the medial collateral ligament. I have to film this. Alright, thank you. Stay down. Now there is another test known as anterior drawer test, in which I will feel your anterior cruciating ligament by the normal knee jerk. If I feel any jerk, there is a following the anterior cruciate ligament. Now there is another test known as posterior drawer test, which will tell me there is any tear in posterior cruciating ligament if I feel any jerk. Okay, I didn't feel any jerk. Thank you so much. Thank you.
Hi, my name is Sarita Kibera and I'm a second year medical student. Today I'll be examining your cranial nerves 1, 2, 3, 4 and 6. Before doing so, I would like to go just wash my hands please. Okay, first off, we'll start with your olfactory nerve, and I need you to cover one side of your nose. Breathe in. Cover the other side. Breathe in. Okay, now I want you to close your eyes, both sides of your eyes, and cover your nose, one side. Can you identify the smell? Yeah, it's coffee. Okay, cover your other side of the nose. Can you identify the smell? It's coffee. Okay, I will test your visual acuity. I want you to cover one side of your eye and then read the 8th row. D, E, F, B, O, D, E, C. Okay, cover your other side. And now we'll do the visual field test. Please cover your right eye. I'll be moving my finger inward. Please tell me when you see him. Okay, now I'll examine your fonda and I'll be using an ophthalmoscope. It might be a little bit uncomfortable. And now I'll test your oculomotor nerve. First thing I'll do is to test for your direct light reflex. Look straight. Okay, now we'll do your convergent test. I want you to focus your eye on the pen. Okay. Now I'll test your extraocular muscles, which are controlled by cranial nerves 3, 4, and 6. You just focus on my hand. Don't move your head. Okay. Okay, we're done with the test. Thank you.
Hi, good morning. Good morning.
Hi Manan, I'm Fiza. I'm a second year medical student from Cerebellum Foundation School of Medicine. Today I have been asked to do your cranial nerve examination, which will require me to test some of your sensations on your face and also your vestibulocochlear nerve. So let's start. Let's start first with the trigeminal nerve. So I'll be using a cotton swab and a toothpick, and I'll be pointing out in different areas on your face, and you have to tell me whether it's sharp or soft. Okay? This is how the soft feels, and this is the sharp. Okay? Now close your eyes. Soft, 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 sharp, 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 sharp. Okay, now you can open your eyes. Now I'll be checking for the corneal reflex. So what you have to do is you open your eyes and you look that way. I'll be putting this in your eye very gently. Okay, fine. Now we'll check the muscle strength. So I would like you to clench your jaw very tightly. Okay. Again. Now I would like you to move your jaw left and right. That's good. Now open your jaw and resist against my fingers. That's a good muscle strength. Now we'll check for the facial nerve. So that's that. Now what I'll do is I'll be putting this sugar solution on your tongue, the anterior tooth of tongue, and we'll be checking if you could taste the sweet sensation. So the anterior tooth of your tongue. Yeah, it's sweet. Okay, that's how it is. Now raise your eyebrows like this. Okay, fine. Some more. Okay. Now close your eyes tightly. Tightly. Don't let me open your eyes. Okay, fine. Now just smile like this. Okay. Now puff your cheeks out like this. Okay, fine. Okay, so let's do the whispered voice test. I'll be closing your ear and I'll be whispering. You have to repeat after me.
9x1 3a1.
I'll be placing this tuning fork on your head and you have to tell me is it the sound is same in both the ears or is it different? Okay. Is it same? Okay, now let's do the Rene test. It's on your mastoid bone over here and then in front of your ears. Tell me when the sound disappears. Can you hear it?
Yeah.
I'll be looking into your ears very gently. Okay, fine. Everything is totally fine. Thank you. Thank you.
Good morning. Okay. Myself, Tadid Mohammed. I'm a second year medical student. Can I ask your name and age?
I'm Alamin. My age is 21.
Okay, today I am going to test your coordination movements. Okay, that is cerebellar movements for the eyes, legs, and arms. Will that be okay for you?
Yes, okay.
Thank you. Okay, now we are going to check for the rapid alternating movements. Can you follow me?
Okay.
Go as fast as you can. Please. The next one. Okay, the next examination. Okay, on the other hand.
test on the arms as fast as you can. Okay. Okay. Start now. And next leg. On the next examination, you can touch your index fingers and then your nose. Okay, start. Then next leg. Right. Now touch my index finger and raise your arms. Okay, 1, 2, 3 times. Okay, now close your eyes and do it the same. Thank you. On next examination, you should take your heels and slide it from here to your big toe. Okay, really slow. Okay. Like this. Now you close, eyes closed. Okay, next step. Eyes closed. Okay, thank you. Okay, for the next examination, can you walk normally? Okay, turn around and go back. Okay, again turn around and come back, come here. Okay. Okay, for the next examination, you need to walk like this, okay? On the heel, you go, go. Okay? Yeah, repeat after me. Okay, for the next examination, you need to walk on toes like this. Okay? Yes, repeat after me. Okay, for the next examination, you need to walk on heels like this. Okay? Now, repeat after me. Okay, fine. Okay, for next examination, open one leg. Then, okay, next. Okay, fine. For next examination, I will have your hands like this. One more. For the next leg. This one. For the next examination, you need to put your feet together and stand still in an upright posture. Okay. Now close your eyes. Close your eyes for 30 to 60 seconds. You need to stand like that. Okay. Okay. For the next examination, you need to hold your hands like this. Hands like this. Okay. Now close your eyes and wait till 30 seconds. Okay. Thank you for your cooperation.
Good day friends, today I will demonstrate how to test the integrity of the cranial nerve 9th, 10th, 11th and 12th. My name is Dr. Vijayavargi Abhishek. What's your name?
Arvind.
So we will first sanitize our hands. I will first start with the examination of the cranial nerve 9th, the glossopharyngeal nerve and the cranial nerve 10th, the vagus nerve. I will listen the patient's voice and ask him to say and I will check for the movements of the soft palate and the pharynx. Usually soft palate and uvula remains in the midline and rises symmetrically. I will note for any dysphagia or difficulty swallowing or odynophagia, painful swallowing. For gag reflex, I will first inform the patient and ask the patient to open his mouth, open your mouth and protrude the tongue out. I will use the tongue depressor and stimulate the back of the throat lightly on each side to check the reflex. In normal healthy individual, there may be diminished reflex also. Now we will move to examine the cranial nerve 11, the spinal accessory nerve, which innervates the sternocleidomastoid and the trapezius muscle. I will first start by looking any atrophy or fasciculations on both sides. Now I will ask the patient to shrug his shoulders against my hands and will note for contraction of the muscles. Now I will ask the patient to turn his head on each side against my hand and check the contraction of the opposite sternocleidomastoid muscle. Okay. Now we will move to examine the cranial nerve 12, the hypoglossal nerve. I will first listen the articulations of the patient's word. Say anything.
Hi.
Now I will inspect the tongue for any atrophy or fasciculations, if any, present. Now I will ask the patient to protrude his tongue out and move side by side and note the uniformity of the movements. Thank you.
Hello, my name is Nikhil Sharma. What's your name?
Hi, my name is Khushi Sharma.
So Khushi, I'm a second year medical student and today we'll be examining your sensory functions. Is that okay with you?
Yes.
Can you please tell me what's your age?
I'm 21 years old.
Okay, let's get into it.
Khushi, first of all, we're going to test for primary sensation, in which we'll do light touch test. For this, you have to close your eyes, and I'm going to use a wisp of cotton. You say now as soon as you feel the touch.
Okay.
Can you please close your eyes?
Now, 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 now.
Now we're going to test for pain sensation. For this, I use a pin with a blunt end and a sharp end. You have to close your eyes and say whatever you feel.
Okay.
Can you please close your eyes?
Sharp, sharp, blunt, blunt, blunt.
Now we'll do the vibration test.
Okay.
For this, you have to close your eyes and keep your hands like this. Can you please do them? Now please close your eyes and say vibration as soon as you feel it.
Vibration, vibration.
You can open your eyes. Now we'll do the temperature sensation test, in which you have to close your eyes, and I use two tuning forks. One is hot and one is cold. You have to tell me what kind of sensation you feel.
Okay.
Please close your eyes.
Hot, cold, 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 hot.
You can open your eyes. Now we're going to do the proprioception test, in which you have to close your eyes and I'll move your toes. You just have to tell me in what direction they're moving.
Okay.
Can you please close your eyes?
Left, right, up, down, right, left, up, down.
So now we're going to test for your discriminative sensations, in which first of all I put some things in your hand and you have to identify what they are with your eyes closed.
Okay.
Can you please close your eyes? Put your hand forward.
Key, spoon, pen.
You can open your eyes. Now we're going to do 2-point discrimination test, in which I use this pin, which I point at your palms, and you have to tell me whether it's touching with 2 points or a single point.
Okay.
Please close your eyes.
2, 1, 2, 2, 2, 1.
You can open your eyes. Now we're going to do the graphesthesia test, in which you have to close your eyes and I'll draw something on your palm. You have to recognize what am I writing.
Okay.
Can you please close your eyes?
3, 5.
Can you give me your other hand?
A, B.
You can open your eyes. Now we're going to do the point localization test, in which you close your eyes and then tell me wherever you feel the sensation. Please close your eyes.
Here, 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 here.
You can open your eyes. Close your eyes and let me know if you feel the touch on both of your sides or only one side.
Both the sides, both the sides, both the sides.
You can open your eyes. Thank you for your cooperation.
Welcome.
Hello,
Hi.
my name is Yadav Deepa. Today I'll be doing examination of your lower extremities. And what's your name and how are you?
Myself Priyanshu, I am fine.
How old are you?
17.
Okay. Let's sanitize ourselves first. Are you comfortable?
Yes.
I'm going to examine you first by observing. I cannot see any sort of involuntary movements such as tremors, fasciculations. After that, I'm going to check your muscle bulk for size and contour. Now I'm going to check your muscle tone. Now I'm going to check your muscle strength. Are you ready?
Yes.
Now we are going to check for certain movements. You ready?
Yes.
First is flexion of hip. For that, I'm going to place my hand on your mid thigh and you have to raise your leg against it. Okay. For extension of hip, I'm going to place my hand on your posterior thigh and you have to put your leg down against it. Next is abduction of hip. Can you spread your legs against my hand? Okay. Now this. Okay. Next is adduction of hip. Can you bring both your legs together? Okay. Spread. Can you do that again? Moving on, next is extension of knee. Can you take that down? Do that again. Good. Next is flexion of knee. Can you keep your leg here? Good. Can you do the same here? Okay. Moving on, next is plantar flexion. Can you push down your toes against my hand? Can you do the same for this leg? Okay. Next is dorsiflexion. Can you pull up your toes against my hand? Do the same. Good.
My name is Arvind. I am a second year medical student. May I know your name, please?
I am Lower.
What's your age?
I am 20 years old.
Okay. Today I am going to examine the motor function of the upper limb. For that, you will have to remove your shirt. Is that okay?
Sure.
Okay, let's start with inspection. But before that, we should sanitize your hands first. Okay. Turn the muscle work. Okay. Put your hand on this. Okay. Down. Hand like this. Okay. And turn over and close your eyes and wait for a few seconds. Okay. For muscle tone, give your hand this. Okay. grid on normal arm flopping. Okay, hold your arm like this. This is for C5 test. Now I'm going to apply some pressure over here. You will have to resist it. Okay. C5 is normal, and this is for C6 and C7 test. Resist me again. Okay. C6 and C7 are normal. Now I'm going to test your elbow for flexion and extension. Okay, hold your arm like this. Okay, for flexion, you have to stop me from pulling them out. Okay. For extension, you have to push against me. Okay. Put your arm like this. Okay. Straighten the wrist. Okay. Stop me from straightening. Okay. Put your wrist down. Stop me from straightening. Okay. Okay. For finger abduction, spread your finger like this. Okay. Now you have to stop me from pushing from here. Okay. Turn over the palm and raise the thumb towards the ceiling. And now you have to stop me from pulling it. Okay. C8, T1 ulnar nerve are normal. Okay. This is for a wrist extension. Okay. Put your hand like this. Okay. Stop me from pushing it down. Okay. And same here. Okay. C7 is normal. Okay. Sure. Now you have to squeeze my finger as hard as possible and not let them go. Okay. Okay. I'm going to palpate the flexor carpi radialis. This is a radial deviation. Now for ulnar deviation, I'm going to palpate the flexor carpi ulnaris. This is ulnar deviation. Touch your nose alternatively. Okay. 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 Your muscle movements are normal. There is no dysmetria. Now you will have to put your palms on your thigh. Okay, and do it like this. Fast. Okay. Your muscle movements are normal. There is no dysdiadokinesia. Okay. This is brachioradialis reflex. C5 and C6. I'm going to strike the hammer on the tendon of the radius. And this is a biceps reflex, C5, C6. Now for triceps reflex, this is C6 and C7.